I'm Jana Gadgill, coming up on tonight's South Today. The cost of dying, why more councils are paying for poorer people's funerals.
My advice to people is put a bit of thought into your wishes so you're not left with essentially a bunch of strangers having to decide.
And as you'll hear in our report, the NHS is also picking up the cost. Also coming up in tonight's programme, the tale of two businesses over payouts to compensate for the closure of Oxford's Botley Road. The boy racer who's choosing a fast-track career at the age of just 15. And behind the scenes on a famous day 40 years ago, a photographer who worked at Live Aid. Hello there and welcome to the programme. Is the cost of living crisis causing a cost of death crisis? Tackling deprivation among older people in England is crucial to curbing an unsustainable increase in taxpayer-funded funerals. That's according to new research carried out by Southampton University in collaboration with BBC South. Not only does it show a sharp rise in the number of people dying in poverty, but for the first time it reveals it's not just local authorities having to foot the bill. In England, around a quarter of what used to be called paupers' funerals are organised and paid for by the NHS. The research suggests that over 7 years, Portsmouth has the highest rates, with around 1 in every 35 funerals paid for by the state. In Southampton, it's 1 in 38. In Reading, it's 1 in 58. Oxford's 1 in 73. And Bournemouth, Christchurch and Poole, it's 1 in every 80 funerals. Our Home Affairs correspondent, Nikki Mitchell, has more.
Inside this simple coffin lies the body of an elderly man. There's no limousine, no flowers, yet what remains matters: dignity and the quiet respect owed to every life. This funeral and cremation in Bournemouth was paid for and organised by the NHS. Neither the man nor his family could afford it.
It's not a case of fault or that they've just isolated themselves. There have been very genuine stories, and this is what I think's amazing, is that you find out that there are amazing stories behind every person. Everybody is unique.
Since filming this service, Bournemouth, Christchurch and Poole Council has taken over the responsibility for all welfare funerals in the area, whether someone dies in hospital or at home.
You feeling all right?
Yeah. While this has helped cut the hospital's spend, BCP's costs have almost doubled to £46,000 in 2024. In Oxford, the City Council's deputy leader says it's like walking a tightrope, striving to uphold the dignity of the deceased while diligently safeguarding taxpayers' money.
Public health funerals can be a really complicated and time-consuming process. You know, it involves going into the deceased person's home, trying to find, a will, trying to track down next of kin, which can take months and months. So you'll be sat in a mortuary while this process takes place. Every effort is made to reclaim the costs from the estate. The funeral you'll end up with is obviously super basic. By default, it'll be a cremation, unless there are religious reasons or, the council finds a will that says otherwise. And if it's a burial, there'll be no marker at the end either.
In our area, Southampton's Centre for Population Change shows Portsmouth as having the highest rates of funerals for those who can't afford them. Here, council papers reveal the continued high demand in recent years and the complex process of trying to claim back money from the estates of the deceased is unsustainable. Costs per funeral have also shot up. Even the most basic no-frills service in Portsmouth has risen from £1,300 to £1,800.
My advice to people is to put a bit of thought into your wishes, put a bit of money aside so you're not left with essentially a bunch of strangers having to decide, because I think most people wouldn't choose to go through this process.
Well, Nikki Mitchell joins me. Nikki, what more can you tell us about the research carried out by Southampton University?
Well, in collaboration with BBC South, the study by the Centre for Population Change has found that nationally, what used to be known as paupers' funerals across England, the numbers shot up from around 4,700 to over 7,000 within 7 years. Last year, a snapshot survey by the Local Government Association estimated that English councils across England are spending about £6 million on cremations and burials for people who can't afford them. And through our data, the academics were able to estimate for the first time what the NHS is also spending, and it is another at least £1 million a year. And with the cost of living continuing to bite, the researchers say tackling deprivation among older people is crucial to cutting these mounting costs.
What we're seeing is this link at the spatial level, the geographical level, between those parts of the country with high levels of deprivation. We also see a relationship with those parts of the country which have high levels of homelessness, and also with other indicators of socioeconomic inequality. And maybe we need to put in place things to prevent people finding themselves in later life unable to afford funerals.
So, Nikki, how does our region compare to others?
Well, given that people here in the south are actually relatively wealthier than they are in many other parts of the country, certainly our councils and NHS are not the worst hit areas. However, there are pockets of deprivation here, hence Portsmouth's struggle to keep up with rising demand. And another conclusion of the researchers is that a better system is needed nationally so that they can predict future demand.
So the need's obvious for people with less money, but are there any other defining characteristics of people that are struggling?
There are, yeah. The difference between the sexes is quite staggering. The vast majority of people who need a public health funeral are men.
We found that men were 3 times more likely than women to experience public health funerals, and one of the reasons for that is the differences in social networks between men and women. Other work that we've done in the Centre for Population Change has actually looked at the rise in unpartnered people. There's been an increase in the number of men, in particular in midlife, who are either never partnered or who are not currently partnered, having experienced marital breakdown. And these men are much more likely also to lose touch with their children and can find themselves in later life isolated.
And you'll be bringing us more on this issue tomorrow, Nikki.
Yes, it's a sad fact that the bodies of some people who have died aren't discovered for many days, weeks, even months sometimes. So in tomorrow's programme, we're going to be hearing from a man from Gosport whose job it is to clean up and decontaminate places where a death has gone unnoticed.